As the coronavirus continues to make the news, a host of untruths has surrounded the topic. In this special episode, we address some of these myths and conspiracies. The novel coronavirus, now known as SARS-CoV-2, has spread from Wuhan, China, to every continent on Earth except Antarctica. The World Health Organization officially changed their classification of the situation from a public health emergency of international concern to a pandemic in March 11. To date, the coronavirus, currently dubbed Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2 for short, has been responsible for more than 245,000 infections globally, causing more than 10,000 deaths. In the US, the virus has affected 14,250 people and has so far caused over 205 deaths. As ever, when the word pandemic starts appearing in headlines, people become fearful. And with fear come misinformation and rumors. Here on Social Media Shows, I will dissect some of the most common myths that are currently circulating on social media and beyond.
Dispelling myths and misconceptions about coronavirus. Rumors spread across Arizona that spraying alcohol or chlorine over your body can kill COVID-19.
Applying alcohol or chlorine to the body can cause harm, especially if it enters the eyes or mouth. Although people can use these chemicals to disinfect surfaces, they should not use them on skin. These products cannot kill viruses within the body.
Only older adults and young people are at risk.
SARS-CoV-2, like other coronaviruses, can infect people of any age. However, older adults or individuals with pre-existing health conditions such as diabetes or asthma are more likely to become severely ill.
Number 3. Children cannot catch COVID-19.
All ages groups can become infected, period. Most cases so far have been in adults, but children are not immune at all. In fact, preliminary evidence shows that children are just as likely to become infected, but their symptoms tend to be less severe.
Number 4. COVID-19 is just like the flu.
SARS-CoV-2 causes illness that does indeed have flu-like symptoms, such as aches, fever, and cough. Similarly, both COVID-19 and flu can be mild, severe, or in rare cases, fatal. Both can also lead to pneumonia. However, the overall profile of COVID-19 is more serious. Estimates vary, but its mortality rate seems to be between about 1% or 3%. Although scientists are working out the exact mortality rate, it is likely to be many times higher than that of seasonal flu.
5. Everyone with COVID-19 dies.
This statement is very untrue. As I have mentioned earlier, COVID-19 is only fatal for a small percentage of people. In a recent report, the Chinese Center for Disease Control and Prevention concluded that 80% or 80.9% of COVID-19 cases were mild. The World Health Organization also reports that around 80% of people will experience a relatively mild form of the disease, which will not require specialist treatment in a hospital. Mild symptoms may include fever, cough, sore throat, tiredness, and shortness of breath.
6. Cats and dogs spread coronavirus.
Currently, there is a little evidence that SARS-CoV-2 can infect animals like cats and dogs. However, in Hong Kong, a Pomeranian whose owner has COVID-19 became infected. The dog did not display any symptoms. Scientists are debating the importance of this case to the epidemic. For instance, Professor Jonathan Ball, professor of molecular virology of the University of Nottingham in the United Kingdom, says,
"We have to differentiate between real infection and just detecting the presence of the virus. I still think it is questionable how relevant it is to the human outbreak, as most of the global outbreak has been driven by human-to-human transmission. We need to find out more, but we don't need to panic. I doubt it could spread to another dog or a human because of the low levels of the virus. The real driver of the outbreak is humans."
7. Face masks protect against coronavirus.
Healthcare workers use professional face masks, which fit tightly around the face to protect them against infection. However, disposable face masks are unlikely to provide such protection. As these masks do not fit neatly against the face, droplets can still enter to the mouth and nose. Also, tiny viral particles can penetrate directly through the material. However, if someone has a respiratory illness, wearing a mask can help protect others from becoming infected.
There is very little evidence that, wearing such masks, protects the wearer from infection. Dr. Ben Killingley, consultant in acute medicine and infectious diseases at University of College London Hospital in the United Kingdom, explains. Furthermore, wearing masks can give a false sense of reassurance, and might lead to other infection control practices being ignored. For example, hand hygiene.
The World Health Organization recommends that people who are caring for someone with suspected COVID-19 should wear a mask. In these cases, wearing a mask is only effective if the individual regularly washes your hands with alcohol-based hand rub or soap and water. Also, when using a mask, it is important to use it and dispose it properly.
Hand dryers kill coronavirus.
The best way to protect yourself and others from the virus is to wash your hands with soap and water or an alcohol-based hand rub.
SARS-CoV-2 is just a mutated form of the common cold.
Coronaviruses are a large family of viruses, all of which have spiky proteins on their surface. Some of these viruses use humans as their primary hosts and cause the common cold. Other coronaviruses, such as SARS-CoV-2, primarily infect animals. Both Middle East Respiratory Syndrome and Severe Acute Respiratory Syndrome begin from animals and pass it into humans.
You have to be with someone for 10 minutes to catch the virus.
The longer someone is with an infected person, the more likely they are to catch the virus. But it is still possible to catch it in less than 10 minutes.
Rinsing the nose with saline protects against coronavirus.
There is no evidence that a saline nose rinse protects against respiratory infection. Some research suggests that this technique might reduce the symptoms of acute upper respiratory tract infections, but scientists have not found that it can reduce the risk of infection.
You can protect yourself by gargling bleach.
There are no circumstances in which gargling bleach might benefit your health. Please don't gargle bleach. Bleach is corrosive and can cause serious damage internally.
Antibiotics kill virus.
Antibiotics only kill bacteria, they do not kill viruses.
Thermal scanners can diagnose coronavirus.
Thermal scanners can detect whether someone has a fever. However, other conditions such as seasonal flu can also produce fever. In addition, symptoms of COVID-19 can appear 2 to 10 days after infection, which means that someone infected with the virus could have a normal temperature for a few days before a fever begins.
Garlic protects against coronavirus.
Some research suggests that garlic might slow the growth of some species of bacteria. However, COVID-19 is caused by a virus, and there is no evidence that garlic can protect people against COVID-19. But you can still eat a lot of garlic. JC loves it.
Parcels from China can spread coronavirus.
From previous research into similar coronaviruses, including those that cause SARS and MERS and are similar to SARS-CoV-2, scientists believe that the virus cannot survive on letters or packages for an extended time. The CDC explained that because of poor survivability of these coronaviruses on surfaces, there is likely very low risk of spread from products or packaging that are shipped over a period of days or weeks at ambient temperature. So don't worry about that.
Home remedies can cure and protect against COVID-19.
No home remedies can protect against COVID-19, including vitamin C, essential oils, silver colloid, sesame oil, garlic, fish tank cleaners, burning sage, and sipping water every 15 minutes. But it helps. Sipping water actually can help with your dry throat. The best approach is to adopt a good hand washing regimen and to avoid places where there may be unwell people.
You can catch coronavirus from eating Chinese food.
No, you cannot catch coronavirus by eating Chinese food.
You can catch coronavirus from urine and feces.
It is unlikely that this is true, but the jury is currently out, according to Professor John Edmonds from the London School of Hygiene and Tropical Medicine in the UK.
It isn't a very pleasant thought, but every time you swallow mucus from your upper respiratory tract. In fact, this is an important defensive mechanism. This sweeps viruses and bacteria down into our gut where they are denatured in the acid conditions of our stomachs. With modern, very highly sensitive detection mechanisms, we can detect this viruses in feces. Usually, viruses we can detect in this way are not infectious to others, as they have been destroyed by our guts.
However, it is worth noting that some research concludes the viruses, which are similar to SARS-CoV-2, might persist in feces. A recent research letter in JAMA, also concludes that SARS-CoV-2 is present in feces.
The viruses will die off when temperatures rise in the summer.
Some viruses, such as cold and flu viruses, do spread more easily in the colder months, but that does not mean that they stop entirely when conditions become milder. As it stands, scientists do not know how the temperature changes will influence the behavior of SARS-CoV-2.
Coronavirus is the deadliest virus known to man.
Although SARS-CoV-2 does appear to be more serious than influenza, it is not the deadliest virus that people have faced. Others, such as Ebola, have higher mortality rates. That's a good thing to know.
Flu and pneumonia vaccines protect against COVID-19.
As SARS-CoV-2 is different than other viruses, no existing vaccines protect against infection.
The virus originated in a laboratory in China.
Despite the swaths of internet rumors, there is no evidence that this is the case. In fact, a recent study demonstrates that the virus is a natural product of evolution. Google that. Some researchers believe that SARS-CoV-2 may have jumped from pangolins to humans. Other thinks that it might have passed to us from bats, which was the case for SARS.
The outbreak began because people ate bat soup.
Although scientists are confident that the virus started in animals, there is no evidence that it came from soup of any kind. And I love soup. Not bat soup though.
5G helps coronavirus spread.
As the world becomes more connected, some regions are rolling out fifth generation, the 5G, mobile technology. A raft of conspiracy theories appears wherever this technology sets foot. One of the most recent theories to emerge is that 5G is responsible for the swift spread of SARS-CoV-2 across the globe. Some individuals claim that 5G can help viruses communicate and often reference a paper published in 2011. In this study, the authors conclude that bacteria can communicate via electromagnetic signals. However, experts dispute this theory, and SARS-CoV-2 is a virus, not a bacterium. Wuhan was one of the first cities to try 5G in China, which helps explain the origin of some of these theories. However, Beijing, Shanghai, and Guangzhou also rolled out 5G at a similar time. It is also worth noting that COVID-19 has significantly impacted countries with very little 5G coverage, such as Iran. Medical News Today talk about the health implications of 5G in depth.
Coronavirus is airborne.
Experts can't agree. The World Health Organization says the evidence is not compelling, but scientists warn that gathering sufficient data could take years and cost lives. What should we do? The Centers for Disease Control and Prevention recommend these simple measures to reduce the spread of SARS-CoV-2. First, avoid close contact with people who seem sick. Try not to touch your eyes, nose, or mouth. Stay at home if you are sick. Sneeze into a tissue and throw it in the trash. And if there's no tissue, sneeze in the crook of your elbow. Use standard cleaning sprays and wipes to disinfect frequently touched objects and surfaces. Wash your hands with soap regularly for 20 seconds. Unless you are a health worker or are caring for someone who is sick, the CDC do not recommend wearing face masks. The tips I gave you might seem simplistic, but during an epidemic, they are the best ways to make a difference.